Happy Thursday, Modexus. This is Alan coming to you from my beautiful office in Vancouver. Recently, there was a great article posted in the product community. If you haven't read it, I would strongly advise you go look at it. It regards the risk factor for dementia in women. Now, this article specifically talked about Alzheimer's and the over 200% greater risk of Alzheimer's in women than in men. Now, I would like to expand on that and just let you know that dementias of all kind are more likely to appear in women statistically because of several factors. So women can be up to 300% more likely to have a dementia than men. The number one reason is just age. Simply, women live longer. And because they live longer, they're more likely to have a dementia, and that definitely goes into that statistical number. So women on average live about 10 years longer than men, so that 10 years does, of course, add into the statistics. The other reason is, and this is where this article didn't mention this, but often women do not have Alzheimer's. They have something that's called cardiovascular derived dementia. And this is a result of not maintaining adequate blood flow to the brain. And I really feel that this is something that needs to be addressed because women all their life have been told to avoid the gym. And that is actually very bad information. Women should be exercising as much as men. And men tend to exercise more, so that plays into the statistics as well. And what happens when we exercise when we're older? Well, number one, we maintain lean muscle mass, which allows us then to regulate sugar more efficiently, and sugar being inflammatory and Alzheimer's being type 3 diabetes, that means we can mitigate our risks through exercise. But there's particular types of exercise that we should do. High intensity interval training. And this is something that women also have been told to avoid, and it's bad information. Because the only way we get something called brain-derived neurotrophic factor, or BDNF, is through high-intensity interval training. Now, you don't have to do much. You can do 15 minutes twice a week, and that will create BDNF, which is the most natural brain protective molecule that we make, and we only get it through exercise. So the information that women have been fed, unfortunately, all the information on exercise is men-centric instead of female-centric. Although if you look up Dr. Stacy Sim, that's Dr. Stacy, S-T-A-C-Y-S-I-M, Dr. Stacy Sim, you'll find great information on how women should exercise for age and prevention of dementia. She's awesome at that. And then the final reason is the glial cells in women's brain. So the glial cells are our glutathione production mechanism in our brain. If we're not getting exercise, if we're not challenging our brain, if we're not getting enough glutathione, then we can't detox our brain. So as people get older, they tend to get less mobile, they tend to get less stimulation, and the glial cells tend to function less. So we're not getting the detoxification. So there's many things that play into this. Now, some people have asked me about genetics, and genetics are the same in men and women. Genetics only play about a 15% role in the development of Alzheimer's. You can actually have your APOE gene, that's APOE gene tested, and find out if that is a risk factor for dementia. It is the number one risk factor for Alzheimer's. And once again, the way to mitigate the effect of that ApoE gene is exercise and glutathione and some other things like omega fatty acids. There are other things you can do. That's a whole very well documented science in and of itself. So anyway, I just wanted to jump in here and reassure women that this does not have to be your course in life. You do not have to look forward to getting dementia later on in life. If you take glutathione, if you exercise, and if you do some other things with diet, an anti-inflammatory high protein diet, we need more protein as we age. There are many things that you can do to mitigate this risk. So Hopefully this is great information. I hope you're having a great week, and we'll talk to you soon. Bye for now.